we're going to spend a lot of time, a lot of effort, and a lot of money on the opioid crisis.
The synthetic opioid fentanyl is causing carnage like America has never seen. I'm on a raid with the task force dedicated to stopping the trafficking of heroin and fentanyl, which is killing more people than ever before.
It's being called the third wave in the opioid epidemic, an alarming rise in deaths from fentanyl.
Almost every ambulance in Chico, California is sent to the same house.
This is probably the worst drug situation in our country in decades, if not a century.
Lester, this summer, a 13-month-old baby came in with an overdose.
And I can imagine a lot of hospitals on this learning curve right now.
Yeah, and they're all learning from each other.
His fellow officers give him Narcan, the opioid antidote that's becoming a crucial weapon in the police arsenal.
One crisis that may be causing another for the 50 million Americans living with chronic pain. Breaking news tonight of the opioid crisis. The first criminal charges against one of the largest pharmaceutical distributors in America.
Together, we will end the scourge of drug addiction in America once and for all.
Ruthless and persistent, opioids are killing 130 Americans a day. The number is staggering and only getting worse.
And for the next hour, we examine a problem plaguing the Tennessee Valley. You'll hear from families, addicts, doctors, and those who need the medication just to get through the day. By working together, perhaps we can overcome this crisis. Let's begin with a look at addiction. You're looking at Eric Mann. He was addicted to pills for more than 20 years.
It's a story being played out in homes across the Tennessee Valley.
And Channel 3's Claudia Coco tells us it's a story that could have ended in death.
Eric Mann says his addiction to opioids started in his teens.
My main thing was prescription pills, and I'd get them any way I could.
Even at his place of work.
I went to work at the prison down here as a correctional officer. And started buying pills from the people that I worked with, other guards.
He eventually served time in prison for credit card fraud. His need for the high was stronger than staying out of prison.
Well, to be honest, the legal punishments didn't really deter me. When you're an addict, you don't care about that.
But he says when it came to getting pills, it wasn't tough. 90% came from the emergency room.
I was very rarely unsuccessful going to an ER. I almost always got what I was going for. I actually got pretty good at simulating symptoms of stuff.
He would fake kidney stones. He even ripped his fingernails out with pliers, even scarring himself permanently.
I pour drain cleaner on it and scrub it in with a toothbrush until you get a really bad chemical burn. You go to the ER, and they give you a prescription.
He tried to get clean multiple times.
Got sent to state-run rehabs. I got sent to a program called RSAT in Rock Springs for 6 months. It was basically a boot camp run by the state in a prison. And it took me 20 minutes to relapse after I got out of that program.
But it was his own research that led him to recovery.
The very final thing that I tried is actually what worked, and that was methadone.
Methadone is prescribed by a doctor to help addicts reduce or quit their dependence on drugs. Mann spends thousands a year on the treatment.
Within 2 years of going to that clinic, I was working, bought a new car, I got my own house, got married.
But what he wants people to know is that addiction is more than just a habit.
This addiction is a medical problem. It's not spiritual, it's not moral. It is a chemical imbalance in the brain, and it needs to be treated medically.
Claudia Coco, Channel 3 Eyewitness News.
The origination of opioids may surprise you. Opioids are a class of drugs naturally found in the opium poppy plant. They work in the brain to produce a variety of effects, including the relief of pain. Now, they're best known as prescription medications, often used as painkillers. Tonight, we learn how we moved from this plant used to relieve pain to prescription pills, codeine, morphine, fentanyl, and heroin.
We wanted to know how people become addicted. Researchers from the Mayo Clinic suggest addiction begins with the feeling that is described as numb and worry-free. Regular use of prescribed medications can increase your tolerance and dependence, requiring higher and a more frequent dose, leading to addiction. Channel 3's Caroline Corrigan takes a look at what an addicted brain looks like.
Michael Merriweather has seen the impact drugs have on the body. As the mental health and behavioral navigator for the Hamilton County Coalition, he works with people who suffer from addiction in a program called New Start. He says all parts of the brain are impacted by opioids.
The frontal lobe is definitely impacted. That's where we make decisions. The addicted brain does not light up. It is not an active brain unless the substance is in the brain. Whereas the healthy brain, a good conversation, family outings, anything that is enjoyable will light up portions of that brain.
He says the brain can heal over time if someone decides to start a clean lifestyle.
It's trying to convince them that they are worth the effort for treatment. Letting them know, I mean, I'm a stranger to them, but letting them know what we can do for them if they're willing at no charge. Many people will say, okay, I'm tired of this lifestyle, sign me up. That's a joy to get just one or two people excited about themselves to change their life.
Now, according to the Centers for Disease Control, from 1999 to 2017, more than 700,000 people died from a drug overdose. In fact, 70,000 of those died just in 2017.
In Georgia, more than 1,000 people died from overdoses in 2017. And in Tennessee, the number is nearly twice as many at 1,700 deaths. Serious risks come with taking opioids, even if prescriptions are taken as directed.
The side effects can include addiction, overdose, vomiting, depression, and physical dependence. According to the CDC, anyone who takes prescription opioids can become addicted. In 2016, more than 11 million Americans misused their prescription opioids. Now, the epidemic can be shown in 3 waves.
It started in 1990 with a spike in opioid prescriptions. People were seeing more prescription pills in the first wave. The second wave hit in 2010 with an increase in overdose deaths involving heroin. And in 2013, synthetic opioids involving fentanyl hit an all-time high. Fentanyl can be used in a combination with heroin, pills, and cocaine. It is 100 times stronger than morphine. Not all of those drugs are made in the U.S.
In fact, some of these substances originate thousands of miles away. Our Casey Freeman explains how they get to the Tennessee Valley.
Cities across the country are battling an increase of opioids being used recreationally on the streets and destroying lives. Sergeant Dax McGowan with the Cleveland Police Department has been fighting the rise of opioids for almost 2 decades. He says a majority of the crimes he investigates involves these drugs.
Your burglaries go up, your thefts go up. People are not stealing things to pay their house payment. They're stealing things to afford their addiction.
Marijuana, methamphetamine, heroin, and now fentanyl are the 4 drugs officers encounter daily. McGowan says these opioids are produced in South America, travel to port cities like Miami, then carriers make their way to hubs like Atlanta. Eventually, they end up in places like Cleveland. He says today, dealers selling product hide in plain sight at places like grocery stores and gas stations, which makes it hard for officers to catch everything.
Now it's so spread out, like they're selling dope down here. They're selling dope all the way up north. So there's a 7-mile difference.
Cleveland's crime suppression unit is seeing an increase in the creation of fake tablets that contain fentanyl since the Drug Enforcement Administration started cracking down on doctors who prescribe their medication. The goal for dealers is to give users a stronger high for less money.
You don't know who's making that drug at that time, which makes it very dangerous for our community. You get some of the drug in one spot, you get some of the cut in one spot. If they try to wean themselves off and they go back, they usually try to go back to the same amount in which they were doing before they either went to jail, they either went to rehab, and with that, that's when you usually have your overdoses.
In the last year, Cleveland has seen nearly a 60% increase in drug and narcotics charges. That's according to the TBI. McGowan says their work is far from over as drug distribution changes constantly.
Like any other business, you research. Drug dealers are not stupid, especially ones that don't get caught.
McGowan's unit uses certain tactics focusing on drug dealers in hopes of getting an edge on the fight.
We find high-level targets, and we go after those targets. And to get to those targets, we use different targets.
Reporting in Cleveland, Casey Freeman, Channel 3 Eyewitness News.
And as we try to curb the opioid epidemic, many of the 50 million Americans who suffer from chronic pain say they have difficulty getting the medications they need.
A 2012 national health study showed that more than 11% of adults report having daily pain. And in 2016, the CDC encouraged doctors to consider tapering patients off high doses. But it's harder to wean off strong opioids when patients are living with chronic pain. It's something the family of one of our Channel 3 employees knows firsthand. Channel 3's John Martin has the story.
So pain is something I live with on a daily basis.
Charles McKinney was in a car wreck back in 2001. Chronic pain is his new normal.
My back pain never goes away. It's never gone away. The medication I took, all it ever did was dull it.
His wreck led to 11 back surgeries in just 19 years.
And by the time it was all said and done, I was taking nearly 400 milligrams of Oxycontin a day.
His daily dosage affecting his health and his family.
I missed so much with my children because I was out of it. And when you don't have it, your body craves it. And it makes the pain that much worse when you don't have it.
The withdrawal's too extreme at the time to put the pill bottle away.
You get the shakes. You get sick to your stomach. You run back and forth to the bathroom. Your body goes through convulsions.
And even though he's still living with chronic pain, he knows opioids aren't the answer.
Being on opiates ruins your life.
And he has one simple message for lawmakers.
Find something else that works.
And while Charles McKinney was able to stop taking opioids, it hasn't been that easy for Christy Wells Reese, who's living with lupus, arthritis, and fibromyalgia.
Who's a pretty bird? My legs hurt so much and my arms hurt so much that I don't want to walk to the bathroom.
Christy Wells Reese takes up to 28 pills a day. She says her pain is still too extreme to even do day-to-day activities.
My husband will cut my meat for me because my arms hurt so much.
She was diagnosed with lupus, arthritis, and fibromyalgia at the age of 30, all causing widespread chronic pain.
I've taken pain meds so long that I don't feel any kind of high or anything. I don't notice any difference as far as that goes.
Christy says the negative stigma associated with opioids is hard for her family.
Some people are embarrassed by the fact that I take pain medicine. Some people that love me are embarrassed by it. But I have to have it to function. I had migraines to the point I was going to the ER 2 and 3 times a week because I was having violent headaches and throwing up all the time.
But she knows there are two sides to the coin.
And I've seen medicine used in the wrong way. I've seen alcohol and drugs ruin people's lives. But I also know the other side where pain meds give people their life back.
Her husband is acting as a safety net to make sure she doesn't abuse pain medications.
I personally found it necessary to have someone that I was accountable to. I'm accountable to my husband.
And she wants to make sure the stigma doesn't stop anyone else from getting the help they need.
Do what you have to do to have a life. Don't live in pain. Live.
There's a lot of focus on how opioid abuse affects adults. What about children? The National Institute on Drug Abuse says every 15 minutes in the U.S., a baby is born suffering from opioid withdrawal. Thousands of children are living in foster homes and group homes because of abuse or neglect by their families. The United Hospital Fund Children's Health Initiative reports 8 million children across the country lived with at least one parent with a substance abuse disorder from 2009 to 2014. Channel 3's Lori Mitchell sheds light on some of the youngest victims.
Because our mom always seen that what she was doing was wrong, but she never stopped it. She never tried until everything happened, and then you can't go back.
This 16-year-old knows what it's like to grow up with a chaotic home life. To protect her privacy, we're calling her Rachel. She lived with both parents until her dad died when she was just 7. Rachel recalls the stress of having a mother who was a drug addict.
Because she would take us out to get on the bus, and then sometimes we'd get off and we'd have to wait at the bus stop for her because she didn't want us to walk. But it'd be like 30 minutes to 45 minutes before she even came. So our brother, my older brother, took on the role of just making sure we got home and everything.
Rachel was removed from her home and went to live with her grandmother. She tried maintaining a relationship with her mom.
She would call and say, hey, I'm going to pick you up for the day, and then we'd wait all day and she wouldn't come. And so the next day she would call and she would be like, I'm sorry I couldn't make it yesterday, but I'll do it today. And it was the same thing every day.
Rachel was heartbroken again at age 15 when her grandmother died. She was shuffled to 2 more homes before coming to Bethel Bible Village, a place for families in crisis. Social worker Tricia Tatum helps Rachel and other girls work through their trauma.
A lot of times they take on their own guilt of the situation. They may have not had anything to do with the situation, but they feel guilty because, oh, my parents are gone, or my parents are struggling, or I'm a burden to these people who are taking me on.
62,000 children in Tennessee are living with grandparents or other family members. Nearly 40% of kids that Bethel serves are coming from relative caregiver situations, and the opioid epidemic is fueling some of that growth.
Many times the grandparents have been the fun people in a child's life. And so then suddenly the children comes into their home and they have to become the disciplinarian and make them go to school and make them go to do their homework and make them go to bed. And so the child, depending on the situation they've come out of, sometimes they're coming out of an abusive or a neglect situation and may have behavioral or emotional issues. And so they act out, and then it becomes a struggle with between the grandparents and the child.
Bethel is an alternative to foster care, and the goal is to reunite children with their biological parents or families. Rachel remains close with her siblings. Bethel has provided stability for her.
She is very resilient. She has a lot of strengths that she plays into. She's great at school. She loves to care for people. She's really one of the stronger people in her family system, and she's really thrived at Bethel.
She has a passion for helping others and wants to someday become a nurse.
I can apply to scholarships because my grades are better. I can get into college. I don't have to worry about all the bills to pay for college because I can earn a way now.
Rachel's circumstances have given her strength, and she is giving others hope.
And we have more on the effects of opioid abuse on children. Erlanger doctors say it often starts with expecting moms who are addicted during their pregnancy.
Channel 3's Tanisha Cordell tells us there are steps mothers can take to protect their babies and themselves.
At Children's Hospital at Erlanger, CEO Don Mueller says doctors are delivering more babies addicted to drugs.
When these moms are on drugs, they are exposing themselves and their babies to many obstacles, the most severe of which is having a baby that's born that's addicted to drugs and having them prematurely. Low birth weight babies, you can just stop cold turkey.
It's an uphill battle, Mueller says, is rooted in the opioid epidemic.
Between our 2 birthing hospitals, we see more than 5,000 deliveries a year. So each and every day, our providers are dealing with moms that have been on drugs and used drugs, been on opioids, and these babies are addicted.
Mueller says as a result, newborns suffer from NAS, neonatal abstinence syndrome. In the U.S., he says a baby is born with the syndrome every 15 minutes.
Once these babies are exposed to opioids, they've got to be detoxed just like the parents do. So heart rate skyrockets, they start sweating, they have uncontrollable pain, they scream incessantly because they're in so much pain. Some of these babies are so severe they have seizures, and this can have long-term devastating effects.
Those same long-term effects impact mom as well, but Mueller says getting prenatal care can help.
The only thing that's going to fix this problem is creating a safe harbor where these women can seek prenatal care without fear of being incarcerated or getting in trouble. They need to have safe relationships with their providers.
Our police agencies, hospitals, schools, and emergency responders are now equipped with a life-saving tool.
Narcan reverses 93% of overdoses, and it's being used a lot.
The most Narcan I've given somebody is 12 milligrams, which is 6 doses.
When we come back, we'll show you how the medication is being put to use.
Opioid addiction is devastating our communities. To stop that devastation, we have to treat addiction. Both Georgia and Tennessee have 24-hour crisis lines you can call. In Tennessee, the number is 855-CRISIS. That's 855-274-7471. In Georgia, the number is 800-715-4225. Those numbers and other ways to help will always be available on Channel 3's website and app under the Opioid Crisis section.
Every day across Tennessee, scam artists and con men are ripping off Tennesseans. It's time to put a stop to scams in Tennessee. Scams stop with education. Never give personal information to people you don't know. Scams stop by reporting criminal activity. Scams stop here. To learn scam fighting tips or to file a complaint, contact us at tn.gov/commerce/scams.
76 billion pain pills were distributed to the U.S. over 6 years.
2.5 billion of those pain pills were handed out right here in Tennessee. This data is from the Drug Enforcement Administration, and it shows that in Tennessee, Grundy County had the highest number of pain pills distributed per person in a 6-year span at a rate of 134 pills per person. In Georgia, the county with the most pills distributed per person is Catoosa County, with 58 pills per person each year.
So, who is to blame for the number of pills distributed? A recent decision in a major court case placed the blame on a company by ordering it to pay millions of dollars for its role in the opioid crisis. An Oklahoma judge ordered Johnson & Johnson to pay more than $572 million for pushing doctors to prescribe opioids while downplaying the risks of addiction. Prosecutors say this company's role fueled the opioid epidemic, which led to more than 6,000 deaths over 2 decades.
And it's not just the pharmaceutical companies that are going down. It's the medical professionals who prescribe the opioids. Just this year, the Justice Department has charged more than 60 people with prescription opioid abuse. It's part of the nation's largest opioid prescription crackdown. This takedown included 53 medical professionals, 32 of whom worked in Tennessee. The indictment charged Tennessee doctors, nurse practitioners, and pharmacists with either illegally prescribing or dispensing opioids, as well as fraud related to pain management. In the aftermath, an assistant attorney general said, quote, "If so-called medical professionals are going to behave like drug dealers, we're going to treat them like drug dealers." Now, law enforcement agencies across the Tennessee Valley are doing their part to stop the number of overdose deaths, and the GBI tells our Claudia Coco these efforts are beginning to pay off in Georgia.
We see opioids on a daily basis, and it's a huge problem.
Mitchell Posey is an inspector for the GBI.
We're putting a lot of focus on overdose deaths, and we're working them backwards to the actual drug dealer.
He says an overdose is an indicator that there's a problem area, so that's when they start working backwards.
We can't have that same dealer then turn into 5 bodies, 10 bodies. because that's something that you just can't ignore.
And that's where Deneen Kilcrease comes in. She is the chemistry section manager.
One of the most important things I do as chemistry section manager is to monitor the drug trends throughout the state,
which is a monumental task.
So we test about 40,000 drug cases annually. Our top drug is methamphetamine, followed by cocaine, and then in the third position are the opioids collective.
She says it's not more prevalent in one county to the next, it's a statewide problem.
I then have a master list of all of those results that I can tabulate, and I can track when we do have an outbreak of something in our state.
And when those cases come through their lab, sometimes the drugs are so dangerous, even opening the bag they're contained in has risks.
So the first case that we're looking at here is particularly deadly. It contains carfentanil, it contains heroin, it contains morphine, among other things.
But Posey says the danger is part of the appeal for some users.
User A overdoses, and user B sees that. User B is going to say to themselves, well, I have a higher tolerance level. What I've been using has not been giving me the desired effects, so I'm going to go to user A's drug dealer because I'm not going to overdose, or I'll be more careful than user A was.
But he says it's not just habitual users that are in danger. Someone just wanting to experiment is just as much at risk.
In that one experiment, they don't have the opportunity to wake up the next day and say, okay, that was a bad idea. I'm never going to do that again. Because they die.
But he says by working backwards, they're seeing progress in the fight against opioids. Preliminary numbers show that overdose deaths in Georgia dropped by 12% from 2017 to 2018, falling from 996 to 873. And even if something doesn't result in arrest, the dealers know they're on the GBI's radar.
They at least are put on notice that we're there, we know about them, and at a minimum, it hopefully deters them.
And one of the tools police agencies are using to decrease the number of opioid deaths is Narcan.
The medication reverses 93% of overdoses. Narcan is also known as naloxone. When given to a patient on opioids, it can quickly restore normal respiration to a person whose breathing has slowed or stopped as a result of overdosing.
Chattanooga Police Department says the number of drug overdoses in the city has increased. As a result, officers are administering the medication more often. In the last year, it has been administered to 175 people, and 43 people have died from drug overdoses. Many police officers in our area were equipped with Narcan starting in 2017, but not all the officers in our 3 major counties have Narcan. Plus, police departments in our 3 largest cities have not administered the drug as often as some. For instance, the Dalton Police Department has done so only 5 times since 2017.
In an effort to save a generation, Narcan is becoming more readily available at hospitals in Chattanooga. In the last year, 600 patients were treated with Narcan at Erlanger Hospital, and so far this year, CHI Memorial has had to give nearly 400 doses. Still, nearly 2,000 people died from opioid overdoses in Tennessee last year. Doctors say if everyone were equipped with Narcan, the outcomes may have been different. Hunter Hoagland has the story.
It's the one pharmaceutical doctors count on when time is running out.
Narcan saves lives.
CHI Memorial began giving overdose patients these free kits in July containing Narcan, hoping to save lives across the Tennessee Valley.
You basically just put it in the patient's nose and squeeze it, and it dispenses the medication up the nasal passages, and it's absorbed into the mucous membranes there.
These kits being used to cut down on a shocking statistic from 2018.
There were 1,837 deaths in Tennessee from overdoses.
Dr. Champion says Narcan competes for the same receptors in your brain that opioids do.
It blocks those receptors and thus blocks the effects of the opioids.
Narcan has saved countless lives, but she says it can make patients physically stronger when administered.
They can become violent because we don't always know what we're reversing. We don't know what drug they took always. They can be difficult to restrain sometimes.
Still a small price to pay for a second chance at life.
But those effects are usually gone within 2 hours, and 2 hours versus being dead is worth it.
Dr. Champion says she hopes to end an epidemic after one of her patients died from an overdose.
He had an 8-year-old daughter at home. As a physician, that breaks my heart. So if we can save one life, save one daddy or one mommy, then we've done something.
Paramedics in Hamilton County say they're responding to more drug overdose calls than ever before. Channel 3's Jake Chapman spoke with paramedics in our area about life on the front lines of the opioid epidemic.
Death is a real possibility with this stuff. It kills people every day. We see it.
Take care. Timing is everything when it comes to saving a life.
Doug Evans.
Been a paramedic in Hamilton County
7 years.
When he first started, it was rare that he answered an overdose call.
We didn't run this many overdoses when I first started in this business in 2011.
But in the last 4 years,
I see somebody that struggles with opioid addiction or is overdosed.
It's gotten worse.
We go out on opioid overdoses usually once a shift.
EMTs have a decent supply of Narcan on hand.
We usually use 3 or 4 doses a week at least.
Depending on the drugs, it usually takes 1 dose of Narcan to wake someone up.
It's got 2 milligrams in it. A dose is actually 0.4 milligrams.
But some overdose cases require more.
The most Narcan I've given somebody is 12 milligrams, which is 6 doses.
But what's more alarming is seeing the same person who overdosed more than once. He says he's responded to the same man 3 times in 1 week.
You know, I've had actually people tell me, oh, just give me some Narcan, I'll be all right.
Paramedics say they respond to overdose calls in numerous places.
A restroom because they know somebody will come in and find them if they overdose.
But paramedic Dwayne Meacham says most calls are for people out in the public.
Either that or around friends because they want to be found if something goes wrong. I mean, they know they have a problem.
According to the Hamilton County Emergency Management, they've received more than 20 overdose calls in July. In August, that number slightly decreased. But Evans says those numbers can drastically change.
It's more of an education thing than it is a medication thing.
Evans hopes educating addicts and the general public can put an end to the opioid epidemic.
It's everywhere. It's a nationwide problem, and it just comes down to education. Addicts know about addiction because they're addicted. It's people that aren't addicted that don't necessarily understand what addiction is and how bad it can be.
EMS workers aren't the only ones making Narcan accessible to those who need it. Area school districts are providing Narcan to nurses and school resource officers as well. Here in Hamilton County, school nurses started receiving Narcan training last year. Since then, the drug has been used on only 1 student. The school system's manager of health services, Cheryl Fletcher, says she has seen nurses' roles become even more important. She says nurses know they need to be ready if the opioid problem accelerates in our schools.
Tennessee has an opioid problem. Hamilton County is part of Tennessee. It has an opioid problem. So what happens? When the community has a problem, it has a tendency to impact the schools. Whatever goes on in the community, we have to deal with it in school. We try to manage as best we can in our school settings.
And thanks to partnerships with the Tennessee Departments of Education and Health, the Narcan program in Hamilton County is provided at no cost for schools. Now, schools in Walker County, Georgia also use grants to bring Narcan to nurses at no cost to taxpayers. Since the program started last year, nurses have not had to use it. School nurse John Logan says he and his colleagues are trained on how to recognize the signs and symptoms of overdose. They're also trained on how to administer Narcan through the nose. He says he believes the epidemic is impacting Walker County, and even though nurses haven't yet had to use Narcan, he wants them to be ready.
We can't perform if we don't have the tools in our toolbox. And so this is a tool in our toolbox that helps us in a need of intervention to have that. And it's a life or death intervention. I mean, if we don't have it, then it's not a good thing. It's not going to be a good turnout.
And on a side note, he says he's also concerned about the safety of school resource officers. Due to the strength of drugs like fentanyl, officers are at risk when they have to examine these drugs. Now, millions of Americans are in pain, severe pain. Some suffer from chronic headaches or back pain. Others are recovering from surgery, sports injuries, or even accidents.
But the solution to the pain until now has been powerful opioids. Coming up next, we'll discuss alternative treatments for those living with chronic pain. Opioids, overcoming a crisis. We'll be right back.
Opioid addiction is a crisis for our families, our schools, our communities. In order to address the crisis, we need to address the addiction. If you or someone you love is addicted, there are ways to find treatment. These numbers are crisis lines where you can talk to somebody right now. There are other ways to find help in your community. You can access those resources anytime through the Channel 3 website or app under the Opioid Crisis section. Seeking help can save lives.
145 over 92.
180 over 111. I had a heart attack, a cardiac arrest, and then a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a heart attack or stroke are far from invisible or silent. Get back on your plan or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org.
If I would have followed a treatment plan, I would not be in this situation.
In the mid-90s, they were introduced as the answer to treating pain for hospitals and their patients.
There's a different set of medications that we could use that would probably be as effective and not give you the risk for an addiction to a narcotic. They pushed certain medications, I think, for physicians to prescribe, suggesting that they were safe, non-addictive, and some of that information may have not been correct.
Now in 2019, Dr. Jeffrey Visser says Tennesseans are still feeling the painful effects of an epidemic that, according to the CDC, has taken the lives of hundreds of thousands of people in the U.S. since 1999.
In my early career here, I never saw an opioid overdose unless it was accidental by an older adult who got their medicines mixed up, or someone who had a history of that type of illness or a psychiatric illness that was trying to harm themselves. Now we see it on people who really are kind of normal citizens.
New data from the CDC shows opioid-related deaths in the U.S. decreased by 3% from 2018 to 2019. But Tennessee saw a rise in deaths by nearly 10%.
We see a lot more severe overdoses, people coming in unconscious, difficulty breathing or not breathing that have had to be resuscitated by paramedics.
Visser, one of 2 medical directors at CHI Memorial, says the hospital is one of several across the nation working to lessen the number of deaths proactively through a program known as ALTO, which stands for Alternatives to Opioids.
There's a different set of medications that we could use that would probably be as effective and not give you the risk for an addiction to a narcotic.
The program is centered around using non-addictive medications like Tylenol and Advil for conditions with less severe pain.
But there are a lot of mild to moderate pain conditions, sprained ankles, people with pneumonia that have pleurisy, but don't necessarily need a narcotic for that.
And educating patients on the other pain prevention options that work just as effectively, according to research.
There's multiple studies that show that Tylenol and Advil alternating in combination work better for some fracture pain, sometimes kidney stone pain.
By saying no to narcotics and hello to Alto, they hope to find a new answer to treating pain. But in the meantime, they're working to decrease the number of ODs and deaths in Tennessee. Reporting in Chattanooga, I'm Joy Dukes, Channel 3 Eyewitness News.
Understanding opioid addiction and the stigma it creates is a vital step in the recovery process.
Our society tends to assign negative attributes to whole categories of people.
For example, believing that people who use opioids are dangerous, of certain social or demographic backgrounds, or criminals. But addiction looks the same for every person, no matter their economic classification, and holding addicts to a stigma could prevent them from seeking help. A program here in Hamilton County is working to break the stigma.
And I just completely fell down a horrible hole.
I almost died if someone hadn't found me at the gas station I was at in my car. I wouldn't be sitting here doing this interview.
Addiction took Kelsey McCormick and Kevin Sharber down a dark path. Their stories are similar. Both say they started using opiates as teenagers. Kelsey says she started smoking weed at 13, and by 15, she was using opiates.
My brothers were really bad opiate addicts, and that made it pretty easy for me to be able to get
The spiral continued. Kelsey started using harder drugs like heroin and meth to the point she lost custody of her children. Kevin started using drugs through his veins, traveling to Atlanta to get a supply and selling on the streets of Chattanooga just to avoid withdrawal.
Because we're right in the middle of Atlanta and Nashville. So, you know, we have two biggest highways in the country coming right here through here. I mean, that's why there's so much here.
Both say Narcan brought them back from overdosing, and each decided to turn to a new program in Chattanooga called New Start. They started out with 15 clients. The program now has 70.
Whether you have insurance or not, we will help you get whatever kind of treatment it is that you need, whatever kind of recovery assistance that you need, regardless of your financial situation. You know, it doesn't matter. We're gonna do whatever it takes to get you on the right path.
Michael Merriweather says the program is aimed at treating more than just the addict. It aims at helping the addict's family too.
Those services could include anything from helping kids get into a summer program, get a mentor, go to the Y, counseling for sure. And that's for the caregivers of those children as well.
New Start is also there after treatment is complete, making sure those like Kelsey and Kevin are supported through their path to sobriety.
Even once you've made it through treatment, you're still overwhelmed. You don't know what to do. What kind of aftercare plan do I need? I mean, we're here to do all of that legwork for them.
And while they still deal with the cravings that come with addiction, they're learning how to work through them and getting their lives back.
I never want to do it again. I'd be lying if I said that there was no temptation whatsoever.
It's amazing that I'm here and I'm sober today.
Michelle Herron with that story. CADIS is another rehab program here in Hamilton County that offers help to adults and teens who find themselves unable to pay for care. Executive Director Paul Fuchkar says his team is constantly adapting to the opioid crisis by expanding their 24-hour detox centers and using medication-assisted treatment. He says for him, helping those in need is personal because he has been sober for 24 years. And he says it's easy to start a program with CADIS.
The first step in this process is very easy. All you have to do is come in and have an assessment. You know, let us assess you, be honest with us, tell us what you're doing, and we'll help you identify whether you have an addiction. If you have an addiction, how severe is it? And then present some treatment possibilities for you. You don't have to take advantage of it, but knowledge can never hurt you.
Now, if you or anyone you know is looking for help, Tennessee offers resources across the state, and we have those numbers inside the WRCB app. The cost of opioids affects us all, even if you're not personally connected to an addict. The Centers for Disease Control and Prevention says the total economic burden of prescription opioid misuse in the U.S. is more than $78 billion a year. That includes the cost of health care, lost productivity, addiction treatment, and criminal justice involvement.
Lawmakers are vital in the process of curbing the amount of opioids coming in and out of the country. We spoke with Tennessee Governor Bill Lee and U.S. Senator Marsha Blackburn about their roles in solving this nationwide epidemic. Here's Channel 3's Greg Glover.
Well, you're right in that we have a crisis. It's a significant health challenge that we have. It's one of the reasons that we put additional funding in what we call our healthcare safety net this year.
An opioid problem that perhaps didn't make headlines a few years ago now has everyone's attention. Governor Bill Lee mentioned one of the most common ways this addiction epidemic has popped up on people's radar.
Had a family member that was affected by this crisis, as many Tennessee families have. It cuts across all types of folks all across our state. It's ravaging communities, particularly our rural communities.
Senator Marsha Blackburn says help from lawmakers has to be multi-pronged and multi-jurisdictional.
This is something that is a local, state, and federal partnership, and nobody can solve it on their own.
Tennessee has one of the highest prescription rates, and federal agencies hope alternative pain treatment helps.
We have had several physicians and pharmacists who have worked with HHS on how we get these numbers down. So getting down the prescription rates, making certain that the alternatives and the use of those is fast-tracked, and that is available to healthcare professionals, retraining some of the healthcare professionals on using alternatives. All of these are helping.
Senator Blackburn added she's working to support treatment and recovery.
Here in the Chattanooga area, there is emphasis on that to be sure that people have the time once they are coming from addiction and they've been through detox and they've been through treatment to be able to move to a recovery community.
And finally, the senator is a strong proponent for a key issue in President Trump's agenda that always stirs controversy on the campaign trail.
Another component of that in dealing with the drug crisis is to deal with the southern border. Cartels traffic two things. They traffic drugs and they traffic people.
She says the DEA and Customs report Mexican drug lords are flooding the U.S. with heroin and China-made fentanyl.
They continue to tell us we need three things. We need a border, we need a barrier, that these cartels cannot get through that barrier. We need more officers and agents on the ground, and we need newer technology. And I support giving them what they need.
Back at the state level for Governor Lee, it's about supporting programs that will make maximum impact.
We've also increased our funding to our mental health and substance abuse department that will provide services. We're working with law enforcement to strengthen the laws around and to enforce the laws around prescription distributions. It is something that we absolutely need to address aggressively in order to turn the corner and get our hands around this tremendous problem.
Now, coming up, during the past several days, we've asked you to be part of the solution.
Some of you submitted questions using the hashtag opioid crisis. Next on our special, we'll take your questions to community leaders, medical experts, and lawmakers. And together we will work to overcome a crisis. We'll be right back.
Opioid addiction has far-reaching effects across our communities, and it's up to our communities to come together and treat the addiction. There are ways to find help if you are addicted or you're worried about someone you love. There are 24-hour crisis lines, as well as local providers who can work with you to find ways to afford treatment if insurance is not an option. You'll find a number of places to get help anytime on the Channel 3 website or the app under the Opioid Crisis section.
Thank you. You got a king?
Go fish! In your face, in your face,
It only takes a moment to make a moment. Take time to be a dad today.
3 out of 4 people who have hepatitis C were born from 1945 to 1965. Left untreated, hepatitis C can lead to serious liver disease and even liver cancer. But treatments are now available that can cure this disease. So if you were born from 1945 to 1965, talk to your doctor about getting a blood test for hepatitis C. It could save your life.
And thanks again for watching our special program. The opioid epidemic can only be solved with time, effort, and a nationwide commitment. And that commitment has to start locally. Now, during the past few days, we've asked what you think will solve the opioid crisis. And tonight, we're taking some of your questions to a panel of 6 community and state leaders. We're going to start with TBI Special Agent Tommy Farmer on the end of our panel there. And Tommy has more than 30 years of experience in law enforcement, 20 of which in the field of drug enforcement. Tommy, you're out there every day. What are some of the trends you're seeing and that you're concerned about?
Well, there's no question. We're dealing with the opioid epidemic, and we're going to continue to deal with the opioid epidemic for some time to come. Unfortunately, there are other drugs that are coming down the pipeline, and today it's opioids, and unfortunately, The flavor of the day may change to something like methamphetamine or curving around to something else if we don't address all of the addiction issues.
And our next question is for Chattanooga Police Officer Lieutenant Lewis. Department numbers show there were about 200 overdoses in Chattanooga alone last year. Lieutenant, what is the department doing to hold this number down?
Yes, ma'am. So in July of 2017, we started our formal initiative with our partners at the DEA and the Hamilton County Sheriff's Office. And basically we just tried to track and respond to any opiate-related overdose that we could possibly find out about. While we were dealing with that, we came to realize that it was also a community health issue. So at that point, we started trying to create as many positive partnerships that we possibly could with over a dozen different agencies within the Chattanooga area that are designed to help and care for our community. And then basically since then, we've just tried to continue to collaborate all over the country to try to make sure we talk to different agencies, making sure that we're doing everything we possibly can to address the problem.
So there's a plan. It's not just arresting offenders. It's not just going out and doing that.
Ma'am.
What's being done to help stop people from repeat offending?
So as I stated just before, we're trying to give them different options through our victim service providers and our partnerships that we've created over the last year and a half.
And we have a representative from the health department on our panel. Carlina Anglin works in Hamilton County to combat the crisis. And Carlina, I want to tell you right up front, I've seen some of your work online, your videos, your interviews. You're doing great work, and I want to thank you for that. And let me ask you, what are some of the programs offered by the health department that treat addiction?
Well, the health department doesn't treat people clinically for addiction. What we do is more of a public health respect, where we bring people together, we convene local stakeholders like the Chattanooga Police Department, like the fire department, like treatment centers, and bring people together to talk about where are people falling through the cracks, where can we do better, and so that's where we've been focusing our efforts.
Now we want to talk to Dr. Carol Burge. She's representing the Chattanooga City Council here this evening with us. Thank you for being here. We have a question from a viewer. Deborah Fisher says, well, it's actually a statement, but she thinks that reducing the number of prescription pain pills is not going to drop the number of overdose deaths. So the question is, what do you think will help drop the number of overdose deaths in the city?
Cindy, that's a really good question. I think I'm not so concerned with drugs as I am with where the need comes from. I think that we in government have to come up with policies that meet the food, shelter, and clothing needs of people so that they don't have to turn to drugs. Drugs are a symptom of a sick system. I don't think people wake up in the morning and say, I want to be a loser, I want to take drugs. And I think government particularly has to look at the social indicators, and again, that goes to people's basic needs, so that they don't have to take drugs to feel okay. So I think it has to be a multi-pronged approach, and not just blaming the victim. And I think your viewer's question is hitting the target. If we take these drugs off the street, there's going to be something else. The pain isn't just physical, it's psychological, and it's a system that doesn't seem to care much about people and much about relationships. We're too busy doing this. So I think we need to take a multi-pronged approach.
Dr. Burge, thank you.
And moving now to State Senator Todd Gardenhire, who represents much of Hamilton County in District 10. In the last year, Tennessee has passed TN Together, legislation focusing on prevention, treatment, law enforcement, limits the dosage of opioid prescriptions for patients, creates incentives for offenders to complete treatment programs in jail, and provides $16 million in new state dollars to fund this treatment. Senator Gardenhire, what do you think lawmakers need to focus on as we move forward?
Thank you, David. One of the things that's kind of hidden out there is the vaping phenomena that's going on in junior high and high school. A lot of these students are coming to school or getting a hold of vaping products, and they're substituting some of these opioids and drugs inside the vaping machines. There's little things they can stick in there, and it increases the use of it. We just passed, and the governor just signed this week, a bill limiting some use in youth on the vaping. Second thing is we write most of the checks that fight the opioid problems. We fund the TBI, we fund the health department, a lot of the health department things. We fund a lot of activities that go on with the police department. Ours is a budgetary job that we do. Every legislator that comes up there, every one of them wants to write the most toughest law there is and punish the criminal to the maximum and all that. But at some point you got to pay for it, and that's where we struggle. And you know, you got 82% of our budget goes for 3 items, and that doesn't include fighting the opioid problem. So the things we're going to be wrestling with next year is where do we come up with new money if we have a pullback in the revenue of the state? What do we do? Where do we allocate it? Do we give more to the TBI? Do we give more to law enforcement? Do we give more to the health department? Just where is our priorities? And we're going to be looking very strongly at these priorities next year to see how we maximize the effect of our money that we spend.
Thank you, sir.
And now moving on to County Commissioner Randy Fairbanks. Commissioner, one of our viewers, Seth Cannon, says doctors feed opioids to patients for years and then take them away, telling them, get well soon. Well, tell us about some of the events the county is doing to sponsor events that will fight the crisis.
Well, basically what the county's doing, you know, the county commission is the funding body of the county. So this year in our budget, this coming budget year, we've got about $1.5 million, and that's in about 3 different programs. We've got the Fuse program that the Sheriff's Department has going on, and then we've got the drug court, and then we've got the mental health court. And the Sheriff Department and the judges come back and tell us as commissioners that sometimes the mental health issue and this drug issue go hand in hand. Mm-hmm. And so that's why we have put our money in those programs that seem to be working and have a good track record. Now I will say, like Todd said a second ago, some of that $1.5 million is some grants that have come to us from the state, that come through the county, that we are passing on to these programs. But we're going to spend about $1.5 million in those 3 main programs this coming year to fight this problem.
And working to help those who are addicted, coming alongside them.
Yes, and we've already seen in the last couple of years, we've seen through graduations in these programs, we've seen people that have had these drug problems in the past that are coming off and doing better. And it's just, it's somebody holding them accountable and somebody following up. Earlier we heard someone say that that's an important part of any program is a follow-up. And so that's what these programs do. They follow up with these people and make sure that what they've learned and what they've come through, they can still continue to do in the future.
All right, we want to emphasize once again that by working together, we can make great progress in the fight against opioid addiction. Now, we have resources to help families overcome the crisis inside the WRCB app.
And while we are right now concluding our on-air broadcast, we will continue to talk about solutions to the opioid problem on WRCBTV.com inside the WRCB app. You can also continue to follow the conversation on our Facebook page. We have a great group of panelists here who are with us, and we will continue that conversation.